We usually turn to have calcium supplements after the age of 40. A lot of us even are prescribed by doctors that once you start aging or once you're menopausal, you must start having calcium supplements. But there are so many side effects that come with it when you start having these supplements unknowingly, having them for years without checking with your doctor periodically. This video is all about knowing how, when, what, where about calcium supplements.
So, what is the use of calcium in the body?
Calcium is one of the most important nutrients in our body, and it goes beyond bone and teeth for good health. So we usually consider calcium for our bones, for strong teeth. Yes, that's its primary role, but it goes way beyond that. One of the other functions of calcium is muscle and nerve contraction. So calcium helps your muscles contract and relax, especially when you've worked out, when you have a lot of physical exertion. Calcium is something that prevents those cramps and aches and pains from happening. And as far as the nerve contraction goes, it helps transfer your brain signals to various parts of the body and different organs. So nerve contractions helping with anxiety, depression, and transferring the right signals throughout your body, be it hunger, for your heartbeat, for your bowel movements, is all done by calcium. The third role is in clotting of blood. So especially when you're hurt, when you have a wound, post-surgery, and in general, the blood needs to clot at a particular rate, and calcium is responsible to help clotting the blood. The fourth function is to normalize the heart rate. So calcium, as I mentioned earlier, helps muscle contractions. Your heart is a muscle, so calcium works in regulating your heart rate. So if you see your heart rate shooting up when you're exercising, then you're definitely calcium deficient. And the last function is releasing of hormones and chemicals. So a lot of hormones, especially reproductive hormones, need calcium to be released and to be transported to different parts of the body. And having enough calcium stores in the body makes sure you don't have any hormone related problems.
Interesting. So, who are these people who face calcium deficiency?
Calcium deficiency can happen at any age if your lifestyle is bad. So if you're not having enough calcium foods in your diet, then yes, you can be calcium deficient. But there are some aspects where the calcium necessity is increased. For example, pregnancy. So you need a daily dose of 1000 mg calcium during pregnancy. Children, especially during their growth spurt, need an added calcium intake. People who are geriatric, so after the age of 50, after the age of 60, the need of calcium increases. Post-surgery, so when you have had surgery, especially for the spine, knee, hip, etc., you do need calcium. And if you have symptoms like body ache, if you have calf pains, if you have muscle cramps after you've exercised and they don't go away even after a few days, that's when you should realize that you're calcium deficient and you should think about opting for a calcium supplement.
Doctors also say so that you need to take calcium supplements once you turn 40. Why this is so?
Yes, I mean doctors, at least the old school doctors, say that calcium needs to be taken once you start 40 or when you're menopausal age, because they assume your diet is going to be deficient, and rather than prescribing food and nutrient sources as the first line of treatment, they just say take a pill and be done with it. So honestly, you don't really need to take them once you're 40 unless you face deficiency symptoms or you genuinely have certain hormonal imbalances or a medical condition like thyroid or PCOD which needs extra calcium. Even if you must, you shouldn't really be taking them as a lifestyle that you wake up in the morning, pop in a calcium tablet. That is not what you should be doing. You should always try to have it in a cycle where you take it for a short period of time. Once your symptoms are better, your deficiency is cured, you then wean them off.
There's also risk of calcium overdose. So what are its side effects?
Yes, calcium overdose happens especially when you're taking supplements. It rarely happens through food calcium because food calcium is it in its organic form. It has its supportive elements with it to help correct absorption. So usually when there is excess calcium in your food, in your diet, the body is able to flush it out. But when it is in the supplement form, it is in the synthetic form, in the chemical form, the calcium is not excreted out of the body. And as a side effect, we have seen people develop renal stones, that is kidney stones. They develop high uric acid, which leads to gout, things like frozen shoulder, things like getting spikes in their knee joint, in their hip joint, which then causes knee and hip pain. So calcium can get deposited anywhere and everywhere in the body in all the wrong areas. It can even get deposited in your blood arteries, leading to a development of plaque and a blockage. So side effects of calcium are multiple, and especially with calcium supplements.
So which type and combination of calcium supplements you suggest to be taken?
So calcium comes in various forms. The calcium itself, the two popular forms are calcium carbonate and calcium citrate. The citrate version is easier to absorb, so it is preferred for phases like post-surgery or pregnancy, especially in the third trimester, or for elderly who have digestion issues, absorption issues. Also, the combination, so calcium needs magnesium, it needs vitamin D, it needs vitamin K, zinc, vitamin C to be absorbed. So it depends on your diet, whether your diet is deficient in the other elements or not. If it is, then yes, you might want to opt for a combination supplement. But if you have enough magnesium or vitamin K in your diet, you just want to opt for a calcium supplement with vitamin D in it. So it totally depends on your lifestyle, your need, and the dosage of calcium that you need to be eating.
Right. Can we manage calcium deficiency through food?
Absolutely, you can. So in the first phases, calcium deficiency can be easily managed through food. Only when it is severe beyond a certain point of time is where supplementation is required. We also think that calcium is equal to milk. So if you're drinking milk, if you're having milk products, that's when you get the calcium from. True, I mean, milk products are a very good source of calcium. But those who are lactose intolerant, those who are vegan, those who don't like milk in general, can opt for foods like sesame seeds. So having a spoonful of soaked sesame seeds first thing in the morning does up your calcium levels. Eating green leafy vegetables, eating millets, eating lentils and pulses, especially chickpeas, rajma beans, edamame beans, all of these are high calcium foods. Certain seeds like pumpkin seeds also give you good calcium sources. And all of this calcium is easily absorbed into the body. So you may not need 1000 mg of calcium to manage your deficiency. Even 500 mg of good quality calcium, especially through the diet, can be absorbed fully and can help you manage your deficiency better. So calcium is something which needs to be taken with caution. Please do not pop in medicines randomly. The advice of a qualified doctor or a nutritionist before you start any supplement. Follow the course that they've given, and please do not continue having calcium medicines after that. Please take their advice again, analyze your health, analyze your lifestyle, and only then decide what calcium supplements or what dietary changes you must do. I hope this helps you stay safe, stay healthy, and live the FIMS way of life.